to the Spinal Truth Weekly Podcast Edition. I am your host, Dr. Caleb Slater, here with Chris, what do you do, Chris?
I don't freaking know anymore. You've told me so many things. It's
not
great.
Sure what Chris does.
Video production.
Jill, social media manager and communications expert. We are here to continue our talk on what's wrong with the medical system. We've covered in a previous podcast kind of the system itself, the insurance's involvement, the doctors not having a lot of time. Then we covered some of the imaging flaws, and I think you realized a lot during that episode how poor imaging is in diagnostic utility.
Yes.
Then we started talking about some of the typical treatments, and specifically for pain, it's medications and injections, but we didn't get to what happens next. And that's what I want to talk about.
The more extreme.
The more aggressive treatments.
There you go.
More aggressive.
Yeah.
A little Dark Knight.
That was good.
Recall.
The new Batman's here.
I would do better than what's his name? Patterson. That was awful.
Well, we're not going to go there.
All right. So you have back pain. You first ignore it. Maybe you go to physical therapy, chiropractic. Let's say it's not getting better. Then you go to your doctor. Your doctor sends you to an ortho or neurologist. Your ortho gives you medications, an injection. They might do a local facet injection, so we didn't talk about that. But that's just basically cortisone and pain medication. They might do an epidural. We talked about that a little bit. It's the same thing.
Yep.
Now you're still in pain. What comes next, Chris?
Well, from my understanding, very complicated terms like dorsal anectomies or something.
Dorsal column stimulator. Yeah. That's last resort, actually.
Last resort.
So that's actually after you've had a fusion or multiple fusions.
Okay, so surgeries like fusions and stuff like that.
Yeah, so a laminectomy, discectomy is going to come next, and that's a surgical procedure where they're trying to open up some space in your back. So again, they know that there's pressure being put on a nerve. They're going to try to open it up by just removing a little bit of the disc, removing a little bit of bone that is creating the tunnel that nerve is going through, and opening up some space.
What will be like so say it doesn't actually affect anything as far as the nerve goes or the original problem, but what kind of side effect could that cause? Well,
in general, laminectomy, discectomies are maybe the least bad. Okay. Most of the time, people are getting because they have some radicular pain, meaning pain running down their leg. Okay, if it's back pain, pain running down their leg, pain, numbness, tingling. Most of the time, the laminectomy, discectomy does a pretty good job of taking pressure off that. The problem is that the return rate. The problem is they didn't address the underlying cause. The underlying cause is that your spine, you're putting too much pressure in a certain area, a certain position, certain direction of your spine. You're too stretched in one area, you're too weak in another. You're too tight in one area, you're too weak in another. They didn't address that.
And you're going to continue that
You're going to continue that trend. So eventually you're going to get your problem again. And by the way, I want all of my disc. I want all of my facets. I want my lamina.
Well, I assume there's a decent amount of risk just having that surgery done.
I mean, any type of surgery where you get, put under general anesthesia, it carries a decent amount of risk, especially depending on your age, right?
Yeah.
The older you get or the more unhealthy you are, there's more risk. There's infections, and that's kind of, both of those come with pretty much any surgery that you're going to have. There's also making the pain worse. But again, out of all the surgeries we're going to talk about, the discectomy, laminectomy.
Well, if you go to the doctor and they say they're going to do a discectomy or a laminectomy, what are the chances they say this will fix your problem? Are they ever like, this is 100% going to fix it?
Oh, I bet you they are.
Okay, I was curious. I was wondering if they would more hedge their bet and say, there's a good chance this will help, but it might not.
Rule of thumb, the surgeon undersells what you're going to go through.
Yeah.
So many people, they're like, well, my doctor said I could go back to work tomorrow. And you're like, you just had major surgery. Could you? Yes. Are you gonna? Are you gonna feel like you can? No.
Right.
Yeah, doctor, how many people out there had shoulder surgery? Shoulder surgery, it's a long recovery. It's painful because they didn't need to do surgery to the shoulder in the first place because there was an underlying nerve issue. Because they do surgery at the shoulder, they piss off that underlying nerve issue.
Yeah.
So now you're in worse pain afterwards. It's a long recovery. How many people were told by your doctor, like, oh, you'll be okay in just a few days, a few weeks after this, and it wasn't? Same thing with total knees, total hips, same thing with meniscus is maybe a bad one, because a meniscectomy, they're literally, and most people don't know this, you hear the term meniscus repair. It's not a repair for almost everybody. Unless you're like 16 years old, a certain part of your meniscus that has good blood supply is torn, they're not repairing it because it doesn't repair well. So they actually just go in and they shave the tear down. Okay, so they remove part of your meniscus.
So weakening it overall.
Well, yeah, I mean, your meniscus is the spacer, shock absorber, right, of your knee. They're taking part of it out because they're like, it hurts. And again, we've talked, I think it's somewhere around 50% of people that are 40 years of age have an asymptomatic meniscus tear. So it wasn't the problem in the first place, or it'll eventually recover. And we're getting a little off topic, but the point is that the surgeries themselves aren't good.
Well, the reason I asked that is because like I said before, my dad's had many back surgeries, and I recall many times where there was no sure bet on it. It was a roll of the dice of whether this will help or not, and he was still undertaking it.
How many did he have?
Several, I don't recall.
So I mean, he's probably a great example of this. Yeah. They started in one area, one level. Mm-hmm. They probably started with a discectomy, laminectomy. Then after that, do you know any of his actual?
I know
surgeries?
He has a bunch fused in his neck. He can no longer turn his neck. It's a hole.
Well, so after a discectomy, laminectomy, after that fails, now they go to fusion. Okay, fusion is where they literally. They also do discectomy, laminectomy, but then they make it so that those two vertebrae can't move, right? So they fuse them together to make that space patent stay open
all the time.
All the time.
Yeah.
Okay. All right. So maybe that sounds like a necessary procedure. The failure rate is somewhere within 5 years. It's like 80%.
Yeah.
It's high. It's high of people either having continued pain, different pain, or, and this is very likely, needing another fusion. And why do you need another fusion? Because everything's connected, your spine is a chain, and if I take two links and I say you can't move, but the whole chain still needs to continue to move, the areas above and below are going to take up more force, right? Yep. And again, when you do this fusion, you didn't solve the underlying problem. That the spine was stiff, tight, immobile in a certain area. You were weak or tight in a certain area of your musculature. You didn't address that. Mm-hmm. After the fusion, it gets harder and harder to address that. Not only are you in pain, but you're on medication. You are now more stiff regardless of what you do, right? So, and for me as a clinician, I can no longer mobilize that segment.
If you'd like an appointment, go to thespinaltruth.com and schedule today. We offer both in-person and telehealth appointments, and unlike the medical system, we look to the root of your problem. We look to find the cause, the why your problem, your symptoms are there in the first place, and we expect quick improvement. We expect improvement in pain, range of motion, or strength in the first visit, and 50% or more improvement in most conditions within 4 to 5 sessions. So if you're tired of being in pain, if you're tired of the medical system and its approach failing you, and you want something different, go to thespinaltruth.com and schedule today. Now let's get back to the show.
So even if I wanted to get your movement back, there's already an area of your body that, nope, not going to happen.
So there's a good chance you'll never be able to fix the problem.
At least not at that level, so you have to treat it from above and below, right?
Yeah.
So I'll get people that have had multi-level fusions. I mean, we're talking like 5, 7 vertebrae levels all fused. What can you do? There is still some stuff you can do. You can still strengthen and stretch around the area. You can still work on the local musculature to help decrease pain, and you can work levels above and below, but you cannot get movement from that area. So your body has to compensate. So if I can't get movement from my neck, I'm going to move from my torso, right? If I can't get movement from my torso, I'm going to move from higher up. I'm going to move from my neck. I'm going to move from my hips and knees and ankles, depending on what position I'm in and what movement I'm trying to do. That movement that needs to happen is going to get put off to another body part. So You had your fusion. Your fusion didn't work. You needed another fusion. You probably got it. Now you've had multiple fusions. Now you're still in pain. What's next, Chris?
Well, if you're my dad, you were just on heavy pain management now.
And you're right. The next step is back to the well of pills and injections, right? And then increasing or changing the pills over time. They probably go to a combination of pain medication, muscle relaxers, and anti-inflammatories and nerve pills like Lyrica, Neuron.
Yep.
All right. So now you've been on that, and I hopefully for the people listening to this, I'm not being hyperbolic at all. This is the normal progression. I'm trying to say where you typically go, and hopefully you got off the medical conveyor belt before this, but if you stayed on, this is where you're going. All right, so, and to summarize so far, you started with back pain, maybe you did some physical therapy, chiropractic, didn't work, you did some pills, didn't work, you did local injections, didn't work, you did an epidural, didn't work, and again, when we say didn't work, didn't ultimately work.
Didn't last, yeah.
Didn't last. Now you ended up getting a laminectomy, discectomy, didn't last, fusion, didn't last, other fusion, didn't last, pain medications in a different variety, more of them, long-term pain management, right? So now when they're giving you these pills, they're not saying, try this for a month and see what happens. They're saying,
no, it's permanent.
Here's your regimen.
And I mean, just watching my dad dissolve over the years, in a lot of ways, like this is the cycle. It goes through every few years. There's another surgery or something like that. But the pills are stronger and stronger, and he, from my perspective, loses a lot of sense of self. And I just assumed that his life has been cut shorter dramatically, having been on stuff like this.
And you're saying having been on the medication, and it's very valid. And the side effect of the medication, maybe tamps down his personality, his energy level. It plays havoc on your GI. He
has so many issues with that. Yep.
And that has a big effect on your lifestyle, your energy, stuff like that. But remember too, he's also still in the chronic pain.
Yep.
And after a while, that just becomes debilitating. The pain
itself. He can't sleep in a bed. He has to sleep in a chair a certain way. All this kind of stuff. It's just ridiculous.
Well, and it's constantly on your mind. Like you say, hey, Dad, let's go out for a walk. And his first thought is, how do I feel? How am I going to feel after? Right? Okay. So fusions, multiple fusions, pain medications, injections. Eventually, that's not going to be enough. Where do you go next?
Prayer. I don't know, honestly.
No, there's still 2 more procedures that are going to happen.
These are ones that I haven't heard of probably then.
So have you heard of a nerve ablation?
Just from you briefly saying something about it.
So nerve ablation is basically they chemically or thermally destroy the nerve. So they say, you're still in pain. We can't treat it. We have a pretty good idea. And they do some tests beforehand to see if they're in the right area. We know what nerve is causing your symptoms. We can't help it. We can't fix it. We can't relieve it. So we're going to kill it.
So won't that locally paralyze you?
They find the non-motor branch of the nerve.
Okay.
So it's only the sensory branch of the nerve.
So you still have function, but you won't feel?
You won't feel as much, correct. There's a lot of redundancies in your body. So let's say your sciatic nerve. Your sciatic nerve comes from nerve roots of about 5 different levels.
Okay.
So even if you kill an area, you still get supply from other areas. I'm being a little generalized here, so that way people understand it. But yeah, so they find the non-motor branch of the nerve and they kill the nerve. Does that sound like a good solution?
No.
I mean, that's like, and I actually write this in the book, that's like, my horse's leg hurts, so I'm going to put the horse down. You did fix the problem, but I wanted my horse.
That's frustrating too, because you're so close to figuring it out. It's the nerve. Why?
Well, they knew that all along, though. They knew it was the nerve all along, and
you know what I mean? It's like you're so close. Why don't you just treat the nerve and not kill it? I don't know. That just seems like a stupid way to treat it.
Is it because the person by that point is so debilitated that?
Well, you have a certain amount. All right. This isn't going to come off well. You have a computer issue, right? Mm-hmm. You first know that you have to look to the hard drive, the software. You've done everything that you know in your wheelhouse. What's your like final resort?
Buy a new computer.
Buy a new computer, right? Or a hard reset.
Yeah.
Right? This is kind of a hard reset. And the next one is actually that we're going to talk about is kind of a literal hard reset. At a certain point, you've run out of tools in your toolbox. At a certain point, you've run out of ability that you as a clinician have, right? That we have as treatments. And we've talked about basically the main treatments. We didn't talk about stem cells or PRP injections, but beyond what we've talked about, that's it. That's what we have.
How do you get to that point, though, and not realize, oh, perhaps we were wrong in our original diagnosis then?
But once you've gotten to that point,
it doesn't matter.
It doesn't matter.
Yeah.
Yeah. Once you've fused multiple levels, once you've been in pain this long, sometimes when you've been in pain for so long, even the right treatment isn't going to work. You would need it over a long period of time. The person is just not at a good state to be given it, to work through it.
Mm-hmm. Physically and mentally.
So I recently had a patient in Canada, and she had a tether cord release. And she wanted to come see me in person, and in person I'll do spinal mobilizations, I'll do physical work on somebody. It's not necessary, but it is a nice adjunct. I said, I would actually recommend starting virtually over telehealth with just your own movement, because she's at the point where she couldn't sit down. I literally couldn't sit down, stands to eat. She's in a lot of pain. I know from experience that whatever manual work I do on her, I'm gonna have to press so light that it's not gonna be effective. And if I go just a little too much, I'm gonna stir up her symptoms, her pain. So it's not gonna be worth it at this stage to apply. Okay. We're gonna need to do something else in order to get to the normal treatment that I would do. Kind of along the same lines here, right? At a certain point, somebody's been in pain for so long that even the right treatment, you need something else in order to work up to the right treatment. So this person's been in irretractable pain that can't be fixed. You've tried everything. Now they do the nerve ablation. And again, as a layperson, Jill, Chris, that doesn't sound like the right treatment, right? That doesn't sound like treatment.
No, these sound terrible. And like, I wouldn't want to do any of these.
Yeah, it sounds very scary, honestly.
Especially like you were saying before with the spinal fusion, like if your problem was that you couldn't move that part of your back in the first place, like you're almost just solidifying that by doing the fusion. You know what I mean? Like you can't move that now. So it just seems like, I don't know.
I think it sounds to me, it makes me kind of sad because it's like you are at a level of desperation at that point. Where like this treatment sounds like, I guess this is what I have to do.
This is what, and again, you're getting told this by your doctor. So it's not like somebody off the street is saying,
no,
hey, you should do this.
But walk around Philly long enough, somebody
right. It's your doctor who went to medical school, your doctor who you have a high regard for. And again, it's not just this bad doctor we're talking about.
No.
This is what the most esteemed doctors have to offer you.
If you're out there and you're in pain, if you're tired of the current medical system failing you over and over and over again, just giving you answers that numb you, pacify you to your symptoms, and are largely based on medication, injections, and surgery, and you want a different way, maybe even a better way, look for my book, The Spinal Truth, A New World of Medicine. In it, each chapter I talk about a different symptom, different condition, different body part, and how I view it a little bit differently than the current medical system, and how my treatment has helped so many people out there when they've been let down with the typical approach. This is the way I think medicine should be. This is the change in healthcare I think we deserve. So thespinaltruth.com, you can look for my book on Amazon, Kindle, Apple, and on audio.
So you get your nerve ablation. Now what?
It doesn't work, so...
Doesn't work, you're still in pain. They've fused you. They've destroyed the nerve. Nothing has worked. Pain medication isn't working. Nerve medication isn't working. Muscle relaxers aren't working. And actually, throughout this time, we didn't talk about this, but they actually go to a lot of like SSRIs. They go to a lot of... help me out. What's a good way of putting it? Where they kind of treat the mental aspect of it. as well.
Yeah, like numbing some of the
along
your
this time.
anxieties and
they go to anti-anxiety
depressions,
medication. Yeah. All right. So this didn't work. Now, the final thing is a dorsal column stimulator. And dorsal column stimulators, I honestly don't know if I've ever seen one work. But basically, it's like an implanted TENS unit. A TENS unit is the electrical stim that you would get at a physical therapist, a chiropractor, so they put those electrodes on you. Have you ever had this?
I've seen it, no.
Jill, have you ever had it? No? So they put these electrodes on you, and they put a certain current wavelength through it, and it interferes with your brain's perception of the pain.
Wow.
So it has its utility. Again, it's only temporary. It's only a patch. For people that are in chronic pain, we talked about that, so let's say I poked you in the shoulder repeatedly, right? And let's say I did this for a month.
Jeez, okay.
And then I stopped.
Okay.
What would you notice when I stopped?
I don't know. I feel like I'd probably still feel the pain.
Yeah, would you get like a fan?
You'd still feel the pain. Like
yeah.
me and you wouldn't be friends, and
I don't know. I might like it. We'll see.
After a certain point, it hurts so good. You'd still feel the pain. You'd still feel that sensation, right? So chronic pain is kind of like that. A TENS unit is basically a temporary reset. It's like resetting the router almost of that pain. And so there's value there too, especially using like a TENS unit before you go to bed to get a little bit better night's sleep. Using a TENS unit to decrease some post-treatment soreness, right? And it typically only lasts for about 30 minutes to an hour afterwards. You get that relief, but some relief is valuable to people that are in pain.
And it's like dealing with phantom pain, kind of.
No, not necessarily phantom pain. It's just dealing with pain.
Pain in general. Okay.
Pain in general.
Okay.
Right? Well, what they do is they basically put this inside you.
That's crazy.
So they put again, speaking kind of simplistic, right? They put a implanted TENS unit and you have a remote, you have a control, you can turn it on and off.
Okay.
And they kill your body's ability to perceive the pain. But like what we've talked about, your body has some redundancies in it, right? Your body gets used to stimulus. So what happens is that immediately this tends to work pretty well. Immediately you're like, oh, all right, I feel better. Okay, the pain is tamped down quite a bit. But now you kind of get used to that. You were an 8, now you're a 4. Okay, 50%, and an 8 and a 4, functionally speaking. An 8, I'm in bed, I'm not going out for a walk. A 4, maybe I'm doing some light house chores. I maybe can get some work done, right? I can live a little bit. But that 4 eventually becomes your new normal, and now your body gets used to the dorsal column stimulator. There's some ways around it. So there's like modulation mode, so it changes its wavelength and frequency. It changes it around a little bit, so that way your body doesn't get used to it, but eventually you do, right? Your pain starts to rise back up. Your body's gotten used to it, you've increased it, you've increased the intensity of it. Now that's not working either. Mm-hmm. Now what do you do?
Go back to the doctor.
And now there really isn't a treatment.
This is your life.
Now this is your life. Now we've pretty much exhausted all the treatment out there that you would have for pain. And again, I don't know if you're listening to this and you're saying this doesn't sound normal, nobody goes through this, or if you're listening to this and you're saying, holy shit, this is me, or this is my dad, or this is a friend that I know, this is more common than you think. This is the typical approach. This is what the steps that you would go through. This is something I outline in my book. This is your healthcare system in a nutshell.
I've seen so many people comment on like a whole bunch of your videos just being like, I don't even know where to go at this point because they've tried so many different things and like everything they throw at the wall just doesn't stick. So it's just, I know for a lot of people it's frustrating to not find a solution, especially when you've gone through all these surgeries and you're like, this is going to be it, and then...
Yeah. Well, and I hope the point of this, I hope kind of the takeaway is that the solutions that you're being offered, most of them aren't solutions. Most of them they are literally pain management. They are literally management, pacification, numbing of your symptoms. They are literally addressing the symptom, not the cause. And so you should go, if you go into it understanding that, okay, fine. But I'd say most people don't. Most people don't go into these treatments, quote unquote, understanding that they're not treatments.
Yeah, I wouldn't either, because I feel like the way that that's been shown to us has been like, oh, we're here to fix your problem, even though they don't.
Well, let me ask you this. What would be like the typical time frame to go from the beginning of this process to ending up?
It's a good question. It varies, and it'll vary depending on you, the patient, how aggressive you are in pursuit of your treatment. I had somebody relatively recently, I think she was in Florida, but she seemed pretty aggressive in the pursuit of her treatment, and that led her to multiple different surgeries of fusion, reversing a fusion, fusing multiple other levels, and she was just trying to advocate for herself and her symptoms, but unfortunately, her vigor in her pursuit probably, you can go to a doctor and convince them to do a procedure on you. And most doctors, you know, people will say this, like, if you don't want surgery, don't go to a surgeon, right? Kind of the same thing too. If you don't want a physical therapy answer, don't go to a physical therapist. A good clinician, though, will give you a multi-spectrum option. Though they'll say, hey, look, you can do this first. You can go to this other person. We could try these few steps first. That's a good clinician. Most people, though, they'll give you the response of what they do specifically, what they could do for you, not necessarily what should be done for you.
Yeah, which when you specialize and stuff, that makes sense because that's your world, so you see it from your point of view.
Yeah, and not that they're doing this maliciously, right? No. They're just doing this because this is what they know. They want to help.
Yeah.
They think that they are giving you the solution, but they're not looking broad picture. They're tunnel visioned. They are specialized, and we've become a very specialized society when it comes to the medical care. You don't go to one person that checks your heart and your lungs and your GI. Those are 3 different people, if not 4.
Yeah. Yeah, and there's even, and we can get into this into a different episode, but one thing I advocated to my dad at one point was, why don't you try changing your diet to limit the inflammation in your body? Because I remember when I did keto and stuff for a while, how dramatically different my body felt.
Yeah, and that's a good point. And so
as like an actual another treatment, you know what I mean?
Something I don't talk about a lot on this channel is diet changes, and because I'm not a dietitian, it's not my world.
Sure.
Me personally, though, I've tried a lot of these different diets, and more recently, I just turned 40 and I wanted to go into 40 as healthy as possible. Mm-hmm. So I started looking into this and again, advocating for myself, and I started reading the food labels a lot, and what I found was appalling. But I eliminated seed oils for the most part. I'm now kind of mostly carnivore with just maybe some fruit and or mostly animal-based products. I feel better than I ever have. I started looking into any type of like lotions or shampoos or even clothing, you know, what it has. Detergent, I've changed my detergent. I've made a lot of changes recently because as I started looking into it, I'm like, holy shit, a lot of the stuff that we have is banned in other countries.
Yeah.
And Jill, actually, real quick, look up vitamin C, like Halls, vitamin C, and read the first few ingredients. And then after that, I want you to look up Aleve and read the ingredients in like Aleve naproxen. So you're talking about medication, right? Mm-hmm. You want to think that your medication is helping you. Mm-hmm. Let's take a look at, real quick, let's take a look at this, and then I want you to look up Emergen-C.
Well, it's like a whole bunch of things, not just vitamin C. So it says vitamin C, also known as ascorbic acid, can be found in many forms, including ascorbic acid, sodium ascorbate, calcium ascorbate.
No, but just look up cough drops, the Halls vitamin C cough drops ingredients.
How did you even come to find, like, what made you?
I started reading the ingredients.
Yeah.
And I was like, holy shit.
Sugar, corn syrup, sodium ascorbate.
All right, stop right there. The first 3 ingredients, number 1 was sugar. Number 2 was corn syrup, which is really bad sugar.
Yeah.
And then number 3 was ascorbic acid, so it's vitamin C, but not in a good vitamin C form. So your cough drop that we're giving our kids, right? Sure. So I have 2 young children. They have sore throats. Have some cough drops. And you think you're doing them a service. You're giving them fucking corn syrup.
Yeah.
40 in there too.
Red 40. So there's
Cancer causing it.
Cancer causing ADHD, behavioral changes. Allergic. Right in your cough drops is corn syrup, sugar, dyes, and we're not talking like. We're talking the most common cough drops. This is Hall's cough drops, right?
And that's not like I'll admit, there's been times where I never thought like, oh, I should only have one or two. Like, I'll just sit there for the whole day eating them because my throat hurts.
Your throat hurts,
right? Yeah,
right?
and I don't think about it, and I'm like, oh shoot.
I'm going through something right now, which I think on the last few podcasts people are going to be able to tell. So I changed my. This is Beekeepers Naturals Propolis Soothing Lozenges. I have no affiliation. I don't care if you buy these or not. But these have it's like chicory root, honey.
Well, and that's like they say for like a lot of allergies and for colds and stuff, like just eat a spoonful of honey and stuff because there's natural antibacterial.
And anti-inflammatory, yeah. But again, in your Hall's cough drop, so in your medication, all right, now look up Aleve, Aleve or naproxen, same thing. Look up the ingredients. And then let's look up emergency. So that the thing that you're...
Don't say emergency, I always take that one.
The thing that you're supposed to take on the first hint of
a cold.
Let's see what it says. So you're talking about like getting away from the inflammation, dietary changes, and I think that's very, very important. I think diet is one of the two tenets of health. And so it's diet and then it's activity, and for me, it's how much in what direction you move and strengthen your spine, right? And so you can basically just equate that to movements throughout the day. Move in different positions. Don't just sit there. Make sure that you work out, and when you work out multiple muscle groups, and specifically the posterior chain, like the back, the stuff that has been stretched all throughout your day, right? If you do those two things, you're probably going to avoid a lot of these problems. What do we find, Jill?
It's like not giving me an actual, it just says naproxen, sodium, 220 milligrams.
Do you have your phone on you?
Yeah, what do you want me to look up?
Naproxen, Aleve, the ingredients, and I'm going to do emergency.
Naproxen, Aleve.
You're not going to like this, so if you like emergency, other ingredients, fructose, okay, so that's sugar, fruit sugar, right? Maltodextrin. Do you know what maltodextrin is?
Is it like an anti-caking?
It's another sugar. It's a very bad sugar though. It spikes your blood sugar higher than fructose, higher than corn syrup. Maltodextrin. And maltodextrin's in a bunch of stuff.
Is there a lot in there? Because it kind of tastes gross. I'm surprised that it would have that in there.
And again, in the other ingredients, these are the first two that pop up.
Well, and I even used to work in like the medical cannabis industry, and we always looked at a lot of the medications that we got, and every single one of like the edible forms, the first few ingredients were like 3 different types of sugar. Like that's always the first ingredient.
The inactive ingredients in Aleve starts with blue number 2. Hypromaleose, magnesium stearate, microcrystalline cellulose, polyethylene glycol, providine, talc, titanium dioxide.
I'm pretty sure there's a sugar in there too.
Yeah, one of those might be.
But again, blue number 2, a dye, right?
A dye.
Because they want to make it look pretty.
Yeah.
Why in the medication do we want to dye it? Because the answer is money, right? Because you'll sell more if it's a pretty blue.
Yeah.
But fuck, like I get that we have destroyed our food in America, but you don't realize that also the healthcare, it's permeated into that too. It's corn syrup in your healthcare products.
Which kind of makes sense though, because they're all kind of related. So government, don't come for me, but like, the food that we eat, it makes us sick. The medication that we take makes us more sick. And it's just like a constant cycle of us just paying our money for solutions that don't do anything.
I would love to do an episode at some point on food and dive into that more. And maybe even do like a blind taste test of things and stuff. That would be fun.
I think it's worth it. I'd love to get somebody that knows a little bit more about it,
100%.
maybe on there. So, if somebody's listening to this, and maybe we'll advertise this on TikTok and Instagram. Because I know what I've done for myself personally.
Yeah.
But it's from following other people's advice.
Right.
I don't want to necessarily talk about it as an authority because that's not my realm.
Sure, but I would love to hear somebody with authority talk about it.
But I think it's so important. right?
100%.
I would love to, and it just comes down to time. When I'm working with patients, because I treat a lot of GI issues, a lot of people that are wrongly diagnosed with Crohn's, ulcerative colitis, IBS, gastroparesis, SIBO, stuff like that, right? I treat a lot of these. I would love to also talk about their dietary.
Yeah.
The reason I don't, though, is most of the time they've already tried a bunch of dietary changes.
Yeah.
Although they probably haven't tried the quote-unquote right one. The other reason I don't is that I'm a big fan of limiting my variables. If we're changing their diet and we're working on their spine and they're getting better, they don't know why.
Right.
So, a
future episode, we'll talk more.
Future episode.
But.
All right, so that was 3 episodes of what's wrong with your healthcare system, not just the system itself, but also the tools that it uses to evaluate and diagnose you, and then the treatments that they have to offer. But we talked mainly about the medical treatments in the sense of pills, injections, surgery, stuff like that. What about the conservative approach? So this is my realm. This is physical therapy and chiropractic. What is wrong with those two? This is something that I'm very passionate about. I am going to trash my own profession in this next episode. So if you want to know what is wrong with physical therapy, if you want to know what's wrong with chiropractic care, stay tuned for next week. So that's our show. Hopefully we answered your questions. If you have any other questions, direct message us. You can leave a comment down below. You can reach out to us on Instagram and TikTok, as well as Facebook and YouTube. And you can direct message us at info@thespinaltruth.com. We will see you next week.